Welcome to this edition of The District. I am Joan Garner, your Fulton County Commissioner for District 6. On today's show, we will be joined by Tom Andrews, President of Mercy Care, and Anitra Walker, Director of Behavioral Health at Mercy Care. This past April, Mercy Care hosted its first Community Council to discuss health care and its impact on the poor in Georgia. This forum engaged local community stakeholders along with a panel of experts to discuss important issues such as access to care, service delivery, and Medicaid expansion. Founded by the Sisters of Mercy, St. Joseph's Mercy Care Services was created in 1985 by volunteer nurses and physicians and grew from modest beginnings into a medical home that provides an excellent and integrated system of primary medical care for adults and children, dental care, behavioral health, optometry and vision services, education and social services, reaching thousands of persons in need throughout Atlanta each year. We have a great show planned. Don't go away. We'll be right back. Welcome back to the District. We have a great show planned for you today. I am Joan Garner, your Fulton County Commissioner for District 6. Joining us today are Tom Andrews, President of Mercy Care, and Anitra Walker, Director of Behavioral Health at Mercy Care. Tom and Anitra, welcome to the District.
Thank you.
It's great to have you here today. So Tom, let's start the conversation with you. Would you please share with our viewing audience the history of Mercy Care and why health care for low-income and homeless populations is important to our communities?
Well, first, let me thank you for having us here today. Commissioner Garner, you've been really active in focusing our community around improving health and the health of our community. So we're really excited to be here to talk to you about this subject today. The history of Mercy Care is really kind of interesting. Many people don't recognize that Mercy Care is a part of St. Joseph's Health System. And St. Joseph's Hospital was started in 1880 by four Sisters of Mercy that came from Savannah, Georgia, with about 50 cents in their pocket. And they convinced some local businessmen to give them a building down on Cortlandt Street. And they started the very first hospital here. And they focused on the care of the poor because that was right after the Civil War. And many of the rich here had private doctors, but there was no hospital here to care for the poor. So they maintained that mission for almost 100 years. And then in the 70s, when Atlanta and the downtown area was booming, they were forced to make the decision to either close the hospital or move it. They decided to move it to the Dunwoody area, but soon after they got there, they felt the sisters and the doctors and the nurses who had been focused on the care of the poor in downtown Atlanta felt like they had left their mission downtown. So they created Mercy Care to go back downtown with volunteers initially, and then in 1985 we were incorporated because the growing population of the homeless and underserved that were falling through the cracks in the healthcare system was so severe that they felt that it was their duty and responsibility to stay established in the downtown area. So it's got a really rich history, and we've been in place now for 30 years since 1985.
Wonderful. So you've probably touched on this, but how is Mercy Care a part of the healthcare safety net?
Yeah, I think a lot of people hear the word safety net. They don't know what that really means. But the safety net is created in most major metropolitan areas. And it's a woven together net of healthcare providers that specifically focus on the low-income poor in those communities. And in the center of the safety net here, of course, is Grady. Grady is, in fact, a phenomenal organization that takes care of a good amount of the needs associated with the underserved population. But they can't do it all. So the other providers that help keep that safety net strong are the other community health centers. There are 5 community health centers. Mercy Care is one of them. And the community health centers with Grady make up the safety net. We always think of Mercy Care kind of as the lowest net in the net because we serve primarily people who are at or below 100% of the federal poverty guidelines, the homeless population, about 60% of our patients are homeless, and then of course those people that are uninsured. And so consequently all those nets help to catch the people, but to be quite honest, the safety net isn't really healthy right now. It's got a lot of holes in it.
Okay. So on April the 29th, Mercy Care hosted an event called Healthcare for the Poor, the Georgia Dilemma. Can you tell us or give us some background about the planning for that event and why it is such a compelling topic?
Well, you know, there's been a lot of changes since the Affordable Care Act. Obamacare was implemented, and most people here in Georgia know that this state has not embraced the Affordable Care Act. And our community council was developed to give Mercy Care an opportunity to reach into the community to get people who had similar mindset of really focusing on the care of the underserved and to help broaden the awareness of the need to take care of that population. So it was only natural to launch our council around the focus of expansion of Medicaid and access to the poor. There are about 600,000 individuals in the state that are not going to be covered by the Affordable Care Act because we're not expanding Medicaid. So we created this stakeholder event, invited about 100 individuals in the community to come to talk about that. If we don't expand Medicaid, how do we take care of the care of that population that's going to remain uncovered?
So what would Medicaid expansion actually do for your organization? And then more specifically, how would it improve care and service delivery as well as outcomes?
Well, Mercy Care right now treats about 13,000 patients a year, and of those, only 8% have Medicaid, Medicare, or private insurance. So we have about 12,000 patients that would possibly be covered by the expansion of Medicaid. We operate with a significant deficit every year because we don't have patients who can pay. And so consequently, expansion of Medicaid would provide us with revenue to not only pay for the care that we're already delivering, but it would enable us to expand the care to other individuals who are not covered right now. And we're not alone in this. Grady, the other health centers are in the same situation whereby they have a lot of people that come to them for care and rely on them for care but are not covered by any insurance. So they would equally be impacted by that expansion and be able to expand access to services. And what a lot of people don't understand is in Fulton County and DeKalb County, there was a study that was done recently that looked at all the people at 200% or below the federal poverty guidelines. And of that population, only about 34% were being taken care of by Grady, in primary care centers, or by the health centers. So that tells you that a significant number of the population is not accessing primary health care. And where are they going for that care? They're going to the emergency rooms, or they're going without care, and subsequently they're not managing their chronic diseases, or they're letting situations get out of hand to the point that they end up having to be hospitalized unnecessarily. So we think with the expansion of care to the 600,000 that are uninsured right now and would be covered by the expansion of Medicaid, we'd be improving the health of the community significantly by just giving them access to basic primary care services.
And so could you talk a little more about the outcomes of the meeting that you had in October?
Yeah, it was really exciting. We had a mixed group of people there, and your office was, of course, was represented. And we purposely invited people from both sides of the aisle because we want this to be a direction that we take that we can come up with a solution that everybody can live with. If it's not the expansion of Medicaid, what is it? What does that look like? And there are a lot of other states across the country who've not expanded Medicaid in the traditional sense, which was called for under the Affordable Care Act, but that have looked at different types of models that can work. And so the conversation was, okay, if not the expansion of Medicaid, why? And then if we can't get our arms around that politically, how do we move this forward? The interesting part was a lot of conversation around how do we get the providers, the doctors and the hospitals to want to get excited about the expansion of coverage for the uninsured population. Because there's a lot of misunderstanding and a lot of angst amongst the provider community that expansion of Medicaid may not be the right solution. So how do we get them into the conversation? And we're actually going to do a follow-up meeting sometime in the fall where we're going to invite doctors and nurses and hospital administrators to be a part of the conversation to get their involvement and their input to maybe lead us towards a path of some kind of a solution.
Thank you, and you'll be sure to let our office know about it.
Absolutely, you'll be invited as well.
Great, thank you. Thank you, Tom. When we will take a short break, and when we return, we will continue our discussion with Tom Andrews, President of Mercy Care, and Anitra Walker, Director of Behavioral Health at Mercy Care. You are watching The District. Stay tuned. There's more to come. Welcome back to the district, everyone. I am Joan Garner, your Fulton County Commissioner for District 6. If you just tuned into the show, we are having a discussion with Tom Andrews, the president of Mercy Care, and Anitra Walker, director of behavioral health at Mercy Care. Tom, before the break, you were telling us about how Medicaid expansion could improve care, service delivery, and outcomes at Mercy Care. That leads me to my next question. So, how can we really engage and invoke meaningful conversations with healthcare leaders and government officials with the ultimate goal of identifying and investing in real solutions for healthcare in Georgia?
Well, it's a hard question to answer, but it's something that we really have to focus on right now because we have a disagreement, a political disagreement with regards to whether we should take those federal dollars that were intended to expand Medicaid and give the coverage to the 600,000 folks that I mentioned, or do something different. And I think we're moving in the direction of meaningful conversation has to be, or do something different. Unless there's a different leadership in the state of Georgia next year after the elections, I think we've got to help the governor find the right solution for Georgia, and it can be modeled towards the citizens of Georgia. And I think that's possible. As I mentioned earlier, there are other states that have developed very interesting models that I think we can look to as an approach to discuss that further with the governor. There's a number of safety net providers that have come together to start to put a coalition of folks looking at what are those other alternatives and maybe putting some actual examples in front of the governor to get him in a conversation, which he has indicated he's very interested. He does not want to leave those folks uncovered and leave those federal dollars on the table. So I think there's opportunity. I think the political process has to follow its course here in the next several months, but I think in 2015 we've got an opportunity to really go after, providing the access to care that's sorely needed in our state and especially here in Atlanta.
How can constituents actually get involved or engaged in this process?
Well, they need to understand what the issues are. They need to understand that by not covering the people that currently don't have Medicaid, Medicare, or private insurance, in the long run, we're still paying to take care of those people, but we're taking care of them in inappropriate locations like emergency rooms or in waiting for somebody to be so sick that they have to be hospitalized. So in the long run, it costs more by not providing good preventative services and good primary care services. Even dental. Dental is so hard to access for most people, and dental issues can lead to medical issues many times. So people who are diabetic, if they don't take care of their oral health needs, that can lead to much bigger problems for them in the future. So I think our constituents need to, number one, know that they need to access good primary care, have a primary care home, make sure that they're going and getting their regular checkups, they're staying on top of their chronic conditions. But they also need to make sure that they are politically connected to the people that need to hear from them about their concern about the uncovered population in our state and in our communities. And they can do that through the process of voting. They can do that through the process of calling and writing their representatives, whether it be state representatives, whether it be your office, just making sure that they're acutely aware that this is an issue we have to wrestle with.
So how many of Mercy Care patients are actually insured versus uninsured, and how does that impact your bottom line?
Well, just let me give you a bigger picture. In Fulton County, about 23% of the population is uninsured. It's one of the highest rates in the entire state. And about 33% of the folks are living at or below 200% of the federal poverty guidelines. That's a lot of people that are not getting access to health care services. And Mercy Care, as I said, we're kind of the lowest net. Our population is even more uninsured. About 92% of our patients are not insured, and about 85% live at or 150% or below the federal poverty guidelines. So that's a population that if we weren't here to serve them, they would in fact go without primary care services, dental services, and the other services that we provide.
Tom, thank you.
My pleasure.
Anitra. So Mercy Care also offers integrated behavioral health services.
Yes.
Would you please explain for our viewing audience what is integrated behavioral health and how does it improve your patient's ability to thrive?
Well, integrated behavioral health is a process or a way in which we work with our patients so that we're addressing both their behavioral health concerns and their physical health concerns. Nearly 68% of those who are mentally ill also have some type of chronic illness, diabetes, hypertension, asthma. And so those two things together, if one's not treated, it will exacerbate the other. So you really need to address both, ideally in the same location, in order to really get at the root of what the issue is with that patient. The process in which Mercy Care has decided to tackle this issue and take on integrated care is to model after a program in Tennessee, Cherokee Health Systems. Through that model, we've chosen some parts of it, and what we've decided to do is actually do a screening of an individual initially upon entrance into the clinic. From that screening, we're able to see if there's any behavioral health issues that that patient may have. And that's right there with a brand new patient. And so if there are positive issues or concerns with that patient, then they go in to meet with a licensed clinical social worker, a licensed professional counselor, and from there, the patient and that person can then determine what their treatment would be, whether or not they need ongoing therapy, whether or not they need to meet with a psychiatrist. And all of this is done within the primary care setting. Another great part about integrated care is that because it's done in that primary care setting, the individual is less likely to feel stigmatized and feel as if they have to go to a specialized environment to seek out mental health care. So they're more likely to want to do it that way.
Great. So Mercy Care developed a street machine program or a street medicine program. Why was this program developed, and how does it benefit our communities here in Atlanta?
So one of the biggest things I think with Mercy Care is that we have a really big drive to work with the underserved population. And what we've discovered is that individuals who live out in the street, unsheltered, tend not to access routine medical care. They're the system that we've put in place, they're more fearful of. And so we go to them. So we have a team of folks who actually go out under the bridges, in the woods, encampments, wherever homeless individuals may be, and offer those services. That team consists of a physician, a psychiatrist, an RN, and one of the most important and special people on that team is our outreach specialist. This is an individual who is from that lifestyle. He's formerly homeless, in recovery, and he understands the walk that the homeless individuals have to go through. And so he's able to engage them, get them comfortable in meeting with our physicians and our nurses to determine what their next route of care will be. So it's a great program. It's new to Mercy Care that we started in October, and I'm really excited. We were talking on the way that we're actually going to be able to add some telemedicine to that as well. So we're going to have greater access to more physicians moving forward.
That sounds great. Thank you, Anitra. So, Tom, what is Mercy Care's biggest challenge looking into the future as it relates to being able to continue to work?
Well, in addition to the 92% of our patients don't have insurance, so funding is a big issue. Access to specialty services, that's a real severe problem here in Atlanta especially because Grady can only do so much. There's probably 10 patients lining up for one spot in the specialty clinics that they operate. So specialty care is a big issue. And I think in general, helping our patients understand how they have to take care of themselves. We need to get more of a focus around self-management and people taking responsibility for their health and really being a part of their medical home and accepting that they have a responsibility in addition to their doctor to take care of them and keep them well.
Great. So, Tom, would you please tell our viewing audience how they might contact Mercy Care for more information on your services or how they might even become involved as a volunteer?
Oh, yeah, we'd love to. Our website is www.mercycareservices.org, and all the information you'd want to know about Mercy Care is on the website. Our direct number is 678-843-8500, and we are on Facebook under Mercy Care.
And are you on Twitter?
Yes, we're going to be on Twitter within the month, I promise you, and they've told me I'm going to have to tweet.
Oh, great. Tom and Anitra, thank you so much for joining us today. It was great having you on the show.
Thank you. We appreciate it.
When we return, I will share my closing thoughts. We'll be right back. Welcome back to the district. I am Joan Garner, your Fulton County Commissioner for District 6. Today, we were joined by Tom Andrews, the President of Mercy Care, and Anitra Walker, Director of Behavioral Health at Mercy Care. Since 1985, Mercy Care has provided clinic services to the uninsured, underinsured, persons of low income, the homeless, and HIV-positive individuals on a sliding scale fee according to a patient's ability to pay. The mission of St. Joseph's Mercy Care Services is to participate in the healing ministry of the Church and the Sisters of Mercy by improving the well-being of persons who are poor and disenfranchised through the promotion of health, the provision of health services, and through advocacy for healthy communities. I want to thank Tom Andrews and Anitra Walker for the helpful information they provided us today. And thank you for joining us on The District. That's our show for today. Feel free to contact my District 6 office anytime by calling us at 404-612-8226. You can email us at district6@fultoncountyga.gov, tweet with us at @JoanGarner, and of course, friend us on Facebook. Until we meet again, I am your District 6 Fulton County Commissioner, Joan Garner. Thanks for watching The District.